You are listening to Prevention is the New Cure, all things health and NHS with a political twist.
And that's with me, Dr. Helen Stokes-Lampard, and Steve Bryan MP.
Hello, Helen.
Hi, Steve. How you doing?
I'm good. I'm good. This is episode 28 of your favourite podcast. And today we're just catching up on a number of things, which we'll run through in a minute on the agenda. Last time, of course, we had Marcel on, the CEO of Cited. Quick recap, Helen. Cited is...
So Cited is this really interesting company that are doing work with a test to help diagnose esophageal or upper GI cancer by people swallowing a little capsule that dissolves and a sponge comes out, swells up, and when you pull the sponge out up through people's gullet, it brings cells along, which are sent off to the lab, which can help with the early detection of cancerous changes in the esophagus. And esophageal cancer can be a particularly nasty cancer, and there are certain groups of people with known precancerous conditions that should be screened closely, and this could save lots and lots of people from lots of nasty endoscopies.
You were definitely listening.
I was listening. I really enjoyed that chat with Marcel, actually. He was great.
And he had lovely hair, didn't he?
Oh, he did have lovely hair. I wish people could have seen it, but yeah.
I used to say that. I used to sit with an MP behind David Cameron in the coalition days, and we used to say he had lovely hair. Still got lovely hair. A bit grayer these days, but he's got lovely hair.
Politics does that to you.
Yeah.
Isn't it
yeah.
the Queen is the Queen that infamously says that politics is very aging?
Yeah, right. Anyway, today, I think you were quite keen to talk about the tobacco and vaping bill, which definitely come on to that.
Yeah, I hope so. Yeah.
We were going to have a chat about mental health and MPs and health professionals, which is there's more similarities than not. Might touch on the CAS report
I
and
think
the whole
that'd be
gender
good.
identity
Gender
services
identity.
issue, and then maybe a bit on COVID jabs, which are back.
That sounds like a good plan. It's just us today. No guests.
Just us today. Yeah. So, right, back to the top.
So tell me, you've just come out of the house, haven't you? I saw you speaking about the smoking and vaping bill, which is going through Parliament. So we're recording this on Tuesday afternoon, and the debate is raging as we record.
Yeah, so the debate started about 1:30 this afternoon. It's currently 4 o'clock as we're recording, and I've spoken, and by convention, you have to stay for the following two speeches, which of course I did, and then I've just popped out to have a cup of tea and record the podcast. And so the smoking or the tobacco and vapes bill is having its second reading today, Helen, which is the big moment when MPs decide whether the bill in principle goes through to the next stage, which is detailed scrutiny. So I'm interested because obviously I'm living and breathing this. I've been reading the bill and writing my speech all weekend. I've been doing quite a lot of media on it this morning, and I will later on today. So I'm quite close to it. What are you picking up from the media about this? What are the headlines you're picking up about what's happening here in Parliament today?
Okay, so look, the bit that's shocked me is the degree of opposition that we're hearing, the sort of negativity by some of your more right-wing colleagues. And I'm just honestly, seriously, as a GP, as a healthcare professional, I'm finding myself shouting at the TV or the radio going, what is so controversial about protecting our population from the absolutely catastrophic harms of smoking, and also from limiting the relentless and, quite frankly, immoral marketing of these highly addictive nicotine products to young people? I mean, I know that sounds a bit grand, but quite frankly, I did find myself really chuntering at the radio earlier.
So, okay, I think the best way to explain this is that there's two parts to the bill. There's the tobacco part and the vapes part. On the tobacco part, we commissioned, when Sajid Javid was health secretary, Javid Khan, Professor Khan, to do something called the Khan Review. One of the things that it recommended is that instead of going for a 25 age limit of which you can legally buy cigarettes, which was the call for a while. It was 25 now was the campaign. You may remember. He's now gone for the year-on-year increase. So nobody who is born after the 1st of January 2009 will ever be able...
Alpha.
Yeah, Generation Alpha. They'll never be able to legally buy cigarettes.
Yeah.
And so my son, as I referenced in the speech today, William, who is 13, he will get to 18 and it will keep moving a year out. He'll never catch up with the legal age of which you can buy cigarettes. And, where I'm coming from on this is that smoking as we know, it's the only product on sale legally in our country today that if you follow the instructions as per the manufacturer's advice, there's a fair to middling chance it'll kill you.
Yeah, about 50% chance it'll kill you if you follow
Right.
the
And
instructions.
so,
Yeah.
I would say that Labour governments, Conservative governments have acted in the past. When I was the public health minister in Theresa May's government, I set the smoke-free ambition with
Yeah.
the tobacco control plan, which
Yeah.
which went some way.
Hmm.
Um, and this is about finishing that job. Now, I think the bill can be part of that. As I said in the chamber just now, look, we can increase the budget. We can have a long term workforce plan. We can pharmacy first, take the pressure off GPs. We can do all these things. But at the end of the day, demand is outstripping supply in the health service. And we
Yeah.
can't keep increasing the budget faster than GDP is rising. So we have to look at what we call long term population preventative health. And for me, there's a pretty glaringly obvious candidate here, which
Yeah.
is the biggest preventable killer in our country today, which is smoking.
Exactly.
So, I'm sure you've seen plenty of patients in your
Yeah.
in
Yes.
your
Brain
training days
surgery
in the acute sector and in general practice who struggle to breathe, and
all the
that's
time.
what it'll do to you, right? So that's the smoking part, and I mean
Right.
it's pretty sensible, I think.
Well, exactly. I don't. And what's interesting in terms of some of the negativity I was hearing from people was the the implication that all bans are bad. But I'm surely nobody really believes the original smoking ban from 2006 are bad, do they? I mean, I know back in there you had a free vote back then, and several MPs voted against it then. But surely they've changed their minds over the last 18 years.
Well, I was saying that in my speech is that I think when my son gets to the age that he could legally buy cigarettes
Mm.
under the current law when he gets to 18, he how can we by passing this legislation, what we're doing is we're getting to a position where the state says it's not okay to start smoking when you reach 18. And I think when we look back,
Mm.
how did we ever think that it was okay?
Yeah.
In the same
Well,
way as now,
once we knew the science.
right? And the same way as now, how can we possibly think now that it would be okay to sit in a pub, in a waiting room,
Mm.
in a office smoking? And you just wouldn't do it,
Oh,
and it's just socially unacceptable nowadays. And I think that's what will
okay.
happen with this. Look, you asked about my colleagues, some of my
Mm.
colleagues who are coming from a different pace. And there are people who I'm not surprised they're coming from this place. Someone may have a book out today. And there are other people who surprise me, but they're coming from the line that, you've got to be pro-choice and, a little bit of what won't harm you. And the bottom line, as you know, is there's no safe level of smoking.
So no, no.
And I think Chris Whitty, who I know you and I think a lot of,
Oh,
who was out on the
hero.
radio this morning, he and the other CMOs said to be pro individual choice should mean being against the deliberate addiction of children, young people, and young adults to something that will harm them, potentially fatally.
Yeah.
Enough
Yeah.
said, right?
Exactly. Okay. So look, and you said it's in two parts, the smoking bit and the vaping bit. So what's the objection about the vaping bit? I mean, I understand with bills there's a lot of finessing and fine detail stuff that needs to be worked through. And I'm a big fan of line by line scrutiny and getting it right. But in terms of the concepts, what's the conceptual problem?
Okay, so just when smoking rates among children were going down,
Yeah.
vaping has
As we
massively
Yeah.
increased, right? I think vaping rates have doubled in the 2 years between 2018 and 2020. So, the benefits of vaping as a safer option for adults who are smoking, which is what I had
Yeah.
pursued through my tobacco control plan as the
Yeah.
minister, they're there, right? They're
Definitely.
obvious. But schools are very worried. Talk to any head teacher and they'll tell you
Yeah.
the story. They do in my patch. We heard a lot of evidence through the select committee about that.
Yeah.
So what they're proposing to do is to take powers in the bill to consult on the flavors, the point of sale displays in retail outlets, and the packaging of vapes. And they've got to get on with that ASAP. And then at the same time, DEFRA are consulting at the moment on some draft regulations, I suppose, which will ban disposable vapes.
Okay.
So those pocket money price points
Yeah.
will come out of circulation. I
Okay.
have to say, Helen, I'm circumspect about this. I
Yeah.
think we need to be very careful
Yeah.
about taking away ladders for adult
Yeah.
smokers to climb down.
Yeah.
And,
Yeah.
how often do you have conversations with patients then about, vaping as their route out of
Oh,
smoking?
I mean, every clinical day, they're talking to somebody about it. And, I encourage people to use that. I mean, for most people, trying to go cold turkey and quitting is what they usually do first. And if they fail a couple of times with that, then it's right. What are the alternatives? And whether it's nicotine patches, whether it's vaping. I'm going to give a quick plug for a bit of research I took part in this morning. A
Yeah.
group of medical students at Imperial College are doing a piece of research looking at GPs and GPs' comfort and knowledge about vaping in young people. So we talked about it all the time. And I certainly had many conversations with young people, but do I proactively ask enough about vaping in young people? Perhaps I don't. And given that this is bread and butter stuff for me, and they're obviously looking to see if GPs need any more knowledge. Do we need more research evidence and information? And so I've put on our LinkedIn page the link to the survey. So if any GPs want to do it, I'd love to see them fill it in because I want these students' research to do well. I want to find the truth. What do GPs know and think?
Well, that's great. We'll share that on our
Other socials.
podcast
Yeah.
LinkedIn page, won't we? I mean, the only other thing, just finally on this, is some people talk about there being a retail licensing scheme. So, in the same way as at the moment, retailers who are licensed to sell tobacco and alcohol, there would be
Mm,
a retail licensing scheme for them to then be able to sell vapes instead of
mm.
just banning the disposable vapes altogether. Because at the
Okay.
moment, of course, you can walk down the high street and you'll find vapes flashing, nice
Everywhere.
display in cafes, in hairdressers, in all
Yeah.
sorts of places that are not used to selling age restricted products. So the
Yeah.
industry want a retail licensing scheme. I must say I'm not sure about that because it's coming from industry, and I do worry about that. But the other thing is, this is often raised with me, and I really want to know what you think about this, is the
Mm.
prescription only model, which is whereby, you'd only use vapes under clinical guidance to help adult
And
smokers quit. What do you think about that?
I've got really mixed views about that, Steve, because it medicalizes something that's principally a social thing. Now, the medicalizing bit of it is when people get sick from taking the stuff, when people are so addicted, they're really struggling. So I think the NHS providing help to quit resources is important. But I think if you only have it as a prescription item, you run into you bring a whole heap of people into the NHS, and that otherwise wouldn't need to be. So I've got really mixed. I'd like to see some research on that one before I give a view, because I'm
Yeah.
sure there are people much cleverer than I who've done proper research about it and can give us a balanced view. Perhaps we
Well, I
should
think the
invite somebody
block on
on.
it is that for the companies to bring forward a product that would get through MHRA, which is
Yeah,
what would have to happen,
yeah, yeah.
innovation in this sector of vapes moves so fast and the regulation moves so
So
slow.
slow.
I
Yeah,
don't think it's really ever worth their while to do it. Anyway,
no.
look, before we move on, I just thought I'd play you this clip from what I said in the house. You'll enjoy this.
Oh, go on.
Spoiler alert to start, I will be voting to give the Tobacco and Vapes Bill a second reading this evening. As we might say, prevention is the new cure. What do you think about that, Helen?
Well done, you. Thanks for the thanks for the promotion, the promotion of the podcast. Lovely in the house. You heard it first in hands
Yeah,
on.
right. So what next?
See, I think we should talk about honey traps, Steve.
Oh
Come
yeah, I
on.
like honey.
Yeah, well, fess up. Have you been contacted by Charlie?
So
Or even
this,
Abby?
for those who don't know whether Helen's just being incredibly random here, this
It
is
happens.
a dear colleague of mine, William Ragg, who's the MP for Hazel Grove in the northwest of England, who's stepping down at the next election. Um, he received contact from somebody who was basically trying to honey trap him into sending compromising pictures of himself, which he did, and the story is that he was then blackmailed into sending mobile phone numbers of certain other MPs so that they could try and honey trap those people as well. And they were called Abby or Charlie.
That's it. Oh, Steve. I mean, first of all, I didn't know that William was a friend of yours, but the stress that he must be going through and the stress that everybody caught up in this goes through must be horrendous. And I think the serious bit behind this, I wanted to talk about cyberbullying, cyber blackmail, sextortion. This is a problem that I've seen time and time again. More with young people have come to see me at the practice about it, or parents bringing young people in, but something that anybody can be caught out by in the sort of the modern world. So it's obviously it's a modern crime, but the principles of blackmail and extortion, of course, go back to the start of humanity. Um, I hope William's doing okay. Have there been a lot of MPs affected by this? Has there been much chatter about it?
Yeah, there is quite a lot of chatter about it. I mean, I think there's a lot of sympathy for William, who in some way he's lonely and, and vulnerable and made a bloody silly mistake, right?
Yeah.
We've not all made that one, but we all make mistakes and, let's be careful before we cast stones.
Yeah, and again, this is me with my GP compassionate head on. Is the right support in place for people like him, like other MPs at times of stress? In the NHS, we've got an amazing program called the Practitioner Health Program. Now, this was set up by a really good mate of mine, Professor Dame Claire Gerarda. Started initially for GPs who were struggling with addiction and mental health problems, and expanded to all doctors, and now it's wider across the NHS. And it's a really good, discreet source of help and support for people. And it struck me that, we need a lot more of this in society. Did I pick up that there's an MP service whereby MPs struggling with mental health issues can get extra support?
There is quite a lot of support for MPs, but ultimately, like, different to us than anyone else in society,
Yeah,
you've got to access it
yeah,
and you've got to be open to it. And the
yeah,
trouble is, I guess that it can be a very lonely job.
yeah.
Yeah, there's a lot of people who want a piece of you, and the 70 or thousand people who are your nominally your boss. Um, but it can also be very lonely. And I've tried to reach out to William since this happened. I haven't heard back from him. I know others have, and I've sort of made sure that they are. There's a lot of support there for MPs, yeah. But this practitioner health stuff in the NHS, because it was under threat, wasn't it? And then this week, NHS England have done a bit of a U-turn on it.
Yeah, I think there've been some funding challenges because the whole of the NHS is so stretched thin.
Right.
There has been, but I'm so pleased and relieved. I mean, it really is an awesome program, and clearly I have to be ultra sensitive what I say here, but I have known and spoken to colleagues relatively recently who've accessed it and found it incredibly helpful. And over the years, I've known many reasonably high profile doctors who found help and support there through difficult times. And again, anyone in a senior high profile position is can be very lonely when things go wrong. So yeah, I'm so glad that that's going on.
Mm.
And I guess the last thing is there's I will give a plug for a charity I've got a huge regard for, the UK Safer Internet Centre, set up originally as a way of people reporting cyber abuse and bullying, and reporting any finding of inappropriate images of children online. But it's been expanded to provide help and resources for professionals, which is the way I've known it, but also anyone can now report harmful online content there. So the UK Safer Internet Centre, one, because
Hmm.
there's loads of brilliant mental health charities too.
Very good. Okay, let's take a breather, and when we'll be back.
Welcome back, Steve. Can we talk a bit about gender identity services and the really impressive work done by Dr. Hilary Cass? Do you know Hilary?
I don't know Hillary, but obviously I know of. So the Cass review was published last week. Dr. Hilary Cass is a paediatrician, and the call in the report was for gender services for young people to match the standards of other NHS care. She says in the report the toxicity, quote unquote, of the debate around gender meant professionals were afraid to openly discuss their views. It was commissioned by NHS England in 2020, so during the pandemic, after a sharp rise in the number of patients referred to the NHS who were questioning their gender. And there has been a sharp rise in the number of young people who are questioning that. So what's your experience then in the surgery, doctor, of this one?
So, well, first of all, the sharp rise is very real. We saw a massive increase for a couple of years, particularly just after the pandemic, but it had started before. It probably started about 2017, 2018. We started noticing it, perhaps 2018, 19, thinking about it, where particularly what we call natal females, so people born female wanting to consider transitioning to male. And historically, there's been far more natal males wanting to transition to female. So there was this really interesting thing going on, and people asking for referral to specialist centres, and most specifically wanting hormones to stop them going through puberty. So really big, interesting thing. And I've known Hilary a long time. She was quite a few years ago. She was the president of the Royal College of Paediatricians and Child Health, and I've got a huge regard for her. She's very wise. So this review, as you say, it started a long time ago, and there was an interim review done about 2 years ago while I was still chair of the Academy of Medical Royal Colleges, and we worked with them on that. And the challenge with this whole area of gender identity is that it's such a toxic, polarizing debate. It's become people have been vilified, personally vilified through the media, social media, for daring to speak out because there are a very wide range of views about it. And from my point of view as a GP, what we need is the NHS to be compassionate and providing a proper holistic service to people who are questioning their identity, because it is complex. For some of them, it is a very real thing, and they will go through the whole transition process, often going through surgery, and live their life in a different gender from that which they were born. But those are actually the minority of those who question their gender identity. Sometimes it's wrapped up in autistic spectrum disorders and coming to terms with one's own autism. Sometimes it's tied up with some mental health disorders. In many cases that I've experienced, it's when people have been questioning their own sexuality, and actually it's coming to terms with the fact that they are gay, and all of which people need support with. And the fears are that people are being accelerated down a transitioning route when other routes needed to be supported. And of course, any other mental health issues or physical health issues need to be supported. And actually, once you're on a gender pathway, nothing else was being done for people, is the sort of the gist of what Hillary's report says. So I'm really glad this is out. I'm also really glad that NHS England has been able to sort of move this forward and opened up a couple of new clinics that have launched as of April, but there is a massive waiting list. Have I answered your question on this, Steve? Because
Yeah,
it's complicated.
it's very, very complicated. I don't pretend to know a lot about this subject. What I would say, Helen, is that I think I'm going to say something nice about Boris Johnson,
Please do. Or
which I don't
be
often
nice.
do. But I think Boris was very good on this subject,
Yeah.
and I've talked to him about it privately, and I've heard him talk about it publicly when he was prime minister. He always used to say that when it comes to this subject, we got to recognise that people who want to make a transition in their lives should be treated with the maximum possible generosity and respect,
Yeah. I think
while
that's
recognizing that parents have rights in this and shouldn't be cut out of it. And, when it comes to distinguishing between a man and a woman, the basic facts of biology remain.
yeah.
So, and then this is my bit added onto it. I think you can change your gender, but you can't change your sex.
Yeah. Well, that's right. You don't change your chromosomes. That's pretty clear
Yeah,
cut.
that's what I'm saying. Yeah. And I just think, we should be generous, because these often people in this position are, they're lonely, they're frightened, they're very marginalized, actually. And to feel that anyone's against you must be horrible. But if you feel like, the world's against you, society's against you, the state's against you, and the health service is against you,
Yeah.
you know sometimes vulnerable people do bad things to themselves, and there are plenty of examples, sadly, of that. So we should be kind.
I 100% agree. And the NHS needs to be kind, in a systemic way, which I don't think it has been. And through fear of vilification, people have put their heads in the sand and kept away from this. And I think hopefully this review will open things up, improve the service. I mean, there is a waiting list of around 4,000 children and young people. That's not the adult waiting list, that's just the children and young
Whoa.
people waiting list. That's taken about 4 years to clear currently. So we do need a real injection to speed things up, because people are coming to harm and are going to private clinics, some of which are excellent and some of which are somewhat dubious in the meantime.
Okay.
So, another good thing, sorry, just before we move on, is that the review recommended that people aged 17 to 25 should be on like a follow through service as they move between the child to adult services. And I think that's a really good thing. Yeah, so that would be, if this comes to pass, it would be a good step forward. And at a personal level, I've got a couple of friends who are adults who have successfully transitioned in the past and who live very fulfilled, enriching, and rewarding lives in a different gender from different identity from one they were born with. And so it can happen and be very good. I also have dear friends who are gay, who said to me that when they were teenagers, they questioned their identity as part of the process of understanding their homosexuality, and they are so glad that they didn't accelerate into something. So interesting.
Yeah. Should we press the ding dong button?
Let's do it.
Okay. So COVID jabs are back.
Yes. They are. They are. So COVID jabs, just a quick one, this one. It's the spring booster campaign starting, and I've heard a bit of confusion, so I wanted to put the confusion straight. Spring boosters for COVID jabs are just for the very vulnerable. So it's over 75s. And those with a very weak immune system, and people in care homes for older adults. So not care homes for younger people, but care homes for older adults. And if you fall into this category of being immunosuppressed or one of these, or age or care home, you will have been contacted and offered the booster. If you haven't been contacted and you've had vaccines in the past, you're not on the list.
Yeah. Um, did you see the story about young people's noses?
Oh, I did to tell me, but I
So there's
haven't
a
read it in
headline.
detail.
There's a headline kicking around this week. Young nose cells may help children fight off COVID. Children are less likely than adults to develop severe COVID because cells in their nose are better at fighting off the virus, a new study suggests. And that
Excellent.
study is in something called Nature Microbiology. And
Oh.
we will pop the link to it on our socials. But how about that then? Children's noses.
Well, not totally surprising. So children's bodies are very, very good at many things that adult cells and bodies are getting tired at doing. So not staggeringly surprising, but it is new to me that I hadn't seen that announcement before. So that's great. Very good.
Yeah. I've had a problem with my nose today.
Have you? What's wrong?
Ugh, keep putting my finger up it.
Oh, Steve. Don't pick.
Well, it's perfectly, yeah, it's just like the perfect implement, though, isn't it? That's what
And
my mother used to say. At
no
one point,
fingers
my
up
mother had
noses.
this. Do you remember? My mother bought this stuff once. It was like a mustard. It was like a sort of mustard thing that was put on my fingers to stop me biting my nails and
Uh-huh.
picking my nose when I was a child.
Did it
Difference is I'm
work?
now 50.
Yeah, and she's not there to put it on your nails and nose.
No, no, you definitely didn't want to go to the toilet.
Just remember when you're in the house, Steve, you are constantly on TV.
I'm constantly on TV. Anything else for pod surgery, doctor?
No, I think we should probably wrap it up this week.
Okay.
I'm off on my travels very soon, but I'll tell you about it on my return.
Yes.
Uh, I understand, last question from me is your leadership review in the select committee has started?
Yeah, so really quite extraordinary how much traction this is getting. So we're doing an inquiry on the select committee called Leadership in the NHS, sort of basically with particular reference to patient safety. And we started the inquiry today, actually, Tuesday, the 16th of April, and we had Major Gordon Messenger.
Ah, major
Uh,
mess.
Major Messenger, Major Messenger came in along with Rich Withnell from the
Ah,
Faculty of Management, who you know well, and we both spoke. We talked about him last week. We both
we
spoke
did.
about it at his conference in Manchester last month, and they both came in and gave evidence this morning. As did Matthew Taylor
Oh,
from the
good.
NHS Confederation,
Uh-huh.
and Catherine, who is the sort of acting Public Health Service Ombudsman. So we had the first evidence session on that, sort of just trying to unpack whether we've got good leadership in the NHS at various different levels, how we get better leadership in the NHS, and how we try and get consistent leadership in the NHS.
Excellent. Well, we look forward to hearing the report when that comes out. What's the
Yeah.
sort of time scale?
And if you want a quick Monty update,
I do.
so Parliament is back this week, Helen, and I have to say I've come back to try and get a full night's sleep, even if it is a short night's sleep. Monty's had an upset tummy.
Oh
So
no.
yes,
Doggy
yes.
diarrhea.
Last week on Thursday night, Friday morning, he woke Daddy at 1 a.m., 5 a.m., and quarter to 7 a.m. by crying.
Oh, bless.
Luckily, I hear him. You see, because I'm a very light sleeper. One benefit of it, and wanted to go out, which he did like a bullet. He raced out the door like a bullet.
Better
Bless
than
him.
kitchen
So
floor.
he's on a rice, chicken, and rice diet,
I
which he
love him.
loves. Actually, he's just playing to it, isn't it?
Oh, well, we do hope Monty makes a very swift recovery, Steve.
That's very kind.
You know.
Listen, thank you for listening. We will be back together in a few weeks' time. More than a few weeks' time, but in a few weeks' time, I will be back doing the podcast with a guest who will be joining me. More on that to come. We'll pop that on social media. You can find us on all of the usual social media channels. Please like our show because it really helps us. And if you really want to email, podcast@stevebryan.com.
Thanks, Steve. And just don't have too much fun without me, and I'll tell you all about my travels on my return.
I will try. All right. God bless. See you next
And
time.
you. Bye bye.
Bye.